Hello and good afternoon, everybody. Hi, Allison. Sorry, it wasn't letting us for some reason join in the back room before we started. So Sharon and I have your slides, but normally what we'll do is we'll let you share your screen so that you can go at the pace that you'd prefer. And then if for some reason it won't let you do that, then I can share and skip through them for you. Does that work? Great. Oh, you're on mute.
The first part of that, whatever you were saying, I might have missed because I was trying
Oh,
to
it's
turn
fine.
my headphones on, but I think I got most of it.
Okay, okay. Yeah, no, I was just saying that Sharon and I were in the back room. For some reason, it wasn't letting you in there. So that's okay. So good afternoon, everybody. We're trying to work through some technical difficulties, but it sounds like it's going to be fine. So my name is Aspen Drude. I manage our Center for Rural Health and Nursing here at UTA. If you don't know me, hello and welcome. We have done this seminar series for almost 3 years now, and we focus on all things rural health. And so a few months ago, I met Allison with East Texas AHEC, and we had a great conversation about kind of what they're doing and what they're offering, and wanted to be able to bring that to you all. So that's kind of how we decided on today's seminar. I hope you all are staying warm. I know that this cold front is coming through and it is rough. So I won't take up more time than what is needed. So I will go ahead and pass it over to Allison, and I'll let you introduce yourself and then we can get going on the slides if that works for you.
Sure. Can everybody, am I unmuted? I'm good?
You're unmuted, you're good. And I will
Okay.
monitor the chat as well. So if anybody drops anything in the chat, I will let you know.
Okay, thanks. I've had some technical difficulties as well this morning. So I'm Allison Whitefield. I actually grew up in DFW. So I have experienced firsthand a lot of the challenges to limited access to healthcare. So that deeply shaped, my commitment and what I wanted to do moving forward. So I have a dual master's degree in public administration and social work, and I'm a licensed master social worker who specializes in mental health and substance abuse. As a previous AHEC scholar, I've seen um, the transformative impact of the program myself. And so being able to bring it to the community as a director is just a great opportunity. So I'm excited to be here and thankful for you guys for having me. So I will get started. See if it will work. Okay, so like I said, I'm with Texas AHEC East. My specific region is the DFW region. However, we have regions that span across East Texas into Greater Houston and the coastal region, et cetera. So what I'm going to bring to you today is our AHEC Scholars Program that we offer to rural and underserved communities, people, students specifically that are focused in healthcare for serving underserved and rural communities. So we're going to work on bridging the gaps, building futures with area health education centers, which is what AHEC stands for, and with our scholars driving rural health. 1 second. All right. So the AHEC Scholars Program is a national initiative that equips health profession students with the skills and experience necessary to meet the unique challenges of working in a rural and underserved areas. It emphasizes the interprofessional training and community-focused health interventions. So the program specifically, like I said, we're we're a little part of Texas, but it's part of a national organization, which is NAO, and that, excuse me, is different AHECs across the country. So I'm just with Texas AHEC East specifically, but like I said, this is a national organization across the country. So again, we focus on serving rural and underserved communities. And a big part of the Scholars Program is it is a 2-year curriculum combining the didactic and experiential training of our scholars. Put together a brief little video overview that I'm going to play for you guys because most people have never heard of AHEC or even knows what it stands for. So I thought this would help immensely. Welcome to AHEC Scholars. So excited to have you on healthcare in underserved communities. While AHEC Scholars is a national program with tremendous reach and benefits students and area that it serves, the way states and centers implement their program depends on the needs of traffic base. So let's look at some of the larger details of the AHEC Scholars Program. This is a 2-year program with interprofessional curriculum to implement a defined set of topics through clinical, didactic, and community-based activities. Eligible students must have a current interest in or underserved urban healthcare, currently enrolled in a health profession degree or certificate program, and be 2 years from of those programs. AHEC Scholars core topic areas include interprofessional education, social determinants of health, competency, practice transformation, oral and oral health integration, and current and emerging health issues. AHEC Scholars Program provides students with professional learning opportunities focused on building skills and competencies to help transform primary care and improve patient care, especially in underserved settings. Each year of the program includes hours of community-based experiential clinical training and 40 hours of didactic online education. Didactic curriculum is on the 6 core topics transforming healthcare. Instruction is often self-paced and placed online via lectures, modules, videos, and other curriculum classroom vary for AHEC. Some use Canvas, Blackboard, Google Classroom, and many more. Whatever works best in your area. In addition, each AHEC individually determines or asynchronous is best for their program.
only with other scholars in their state, but also with other professionals inside the healthcare system. The program emphasizes an interdisciplinary, team-based approach to address the health disparities within their community in the curriculum. The Scholars Program allows health professional and allied health students to engage in extracurricular training that is complementary to their academic education by gaining additional knowledge and experience in rural and or underserved urban. In addition, several centers provide their scholars with nationally recognized certifications and trainings, bolster their resume, and bridge the gap between the knowledge they have and the skills employers are looking for. Some examples of what other centers have offered are mental health first aid, national LAS standards, certificate of healthcare improvement, steps, the agency for healthcare research and quality, and more. Upon completion of the AHEC Scholars Program, participants are rewarded with a certificate from the National AHEC organization signed by both the NEM president and their local director. AHEC offers tremendous opportunity for students who are from or interested in working in rural and urban underserved settings. Its program structure develops students with exceptional understanding of the healthcare system.
Okay, so we're not going to go through all of that. That's just kind of a brief overview about kind of NAO and AHEC in itself, and what we strive to do within our different regions. So I'd like to also say, for example, if we have a student that's in the coastal region that wants to do a preceptorship in DFW, we work together to connect these students to different preceptor opportunities, whether they're moving schools or transitioning just in life in general. So that's something that's an added benefit, just having the connection across the regions when students move. But I'm going to go ahead and move on here. Let me. There we go. So the program goals in itself, the AHEC program, the AHEC Scholars Program, it's a national initiative to help equip health professional students with the skills and experience necessary to meet the unique challenges of working in rural and underserved area. Like I said, it emphasizes the interprofessional training and it's community focused. We want to develop leaders in interprofessional and transformative care to improve patient outcomes through innovative practices while addressing the social determinants of health and behavioral health integration. The program in itself has several key goals by enhancing the healthcare workforce diversity, strengthening collaborative care approaches, and addressing critical health disparities in rural communities. One of the best ways that we do that is by connecting our AHEC scholars to preceptorships in these rural areas and being able to kind of give back. So we train somebody from a rural area and then sending them back into that rural area to practice. That's always, you know, number one focus, or in an urban underserved area as well. So by focusing on these priorities, we aim to improve both health outcomes and access to quality care. So the core areas of training are behavioral health integration, interprofessional education, social determinants of health, cultural competency, telehealth and virtual learning, and practice transformation. AHEC scholars receive specialized training in core areas. These specific core areas are essential for effectively addressing the diverse needs of rural populations. So then we kind of go into who's applicable to apply for the program. So there is a preference for students, graduate students specifically in health professions. Examples would be nursing, pharmacy, public health. However, there are various approved disciplines. Among those are massage therapists, dental hygienists, a nutritionalist, a medical illustrator, medical coding specialist, nursing home administration, podiatrist. So it just varies. And there is a lot of disciplines that are approved for the program. I have a complete list that I can send out after this as well. So we, of course, want, we prefer students to have a rural background or committed to rural practice, as well as practice within underserved urban areas as well, with a focus on primary care, diverse and disadvantaged backgrounds. And our application periods are threefold: fall, spring, and summer. So the criteria to participate is 40 hours of didactic and experiential training. So we do offer didactic trainings both with our CEs within various training sites. So they'll offer those CEs either in person or virtually. We have various options for many different CEs, as well as the didactic modules that the students will go through at the very beginning in their first year. And then the experiential training would kind of fall into those preceptorships and partnerships with our community universities, different hospitals, et cetera. It just kind of depends on the region. And then number two, they would engage in interprofessional and telehealth activities via those CEs, et cetera. And then three, they would complete a follow-up 1 year after they complete the program. So there's a various there are various benefits to joining the AHEC Scholars Program. It's unique opportunity to make a difference in underserved areas. Participants gain valuable real-world experience and are able to enhance their professional skills and position themselves for rewarding careers in healthcare. We also offer an annual stipend. After year one, the students typically will receive 500, and then after year two, they receive 1,000. So it's a total of a $1,500 stipend. They'll also receive a certificate of completion that the video stated would also have our national organization on it, as well as the director level, and various networking opportunities with national AHEC scholars and different leaders, and then mentorship from primary care and rural health experts. So some of the disciplines that are included would be nursing, pharmacy, dentistry, public health therapy, vision care, emergency medical services, counseling. But like I said, there is a list of like 20 plus various disciplines that are accepted into the program. It's an extensive list that I can send to you after the fact. But it definitely brings together students from a range of health disciplines, fostering interprofessional collaboration. And with this approach, we ensure that the scholars are well equipped to deliver comprehensive team-based care in their future roles. So why it matters for rural communities and urban underserved communities alike. So this helps rural communities that face significant healthcare challenges, from workforce shortages to limited access of services. Programs like AHEC Scholars are vital for addressing these gaps and ensuring that rural populations receive the care that they need. So first, they need to gain that interprofessional training, be recognized as a certified leader in primary care, and be prepared to address the healthcare challenges in those underserved areas. So I believe this is my last slide, which kind of gives a little more information. So it's got a link to our UTMB AHEC website, as well as the DFW region's website and the program application in itself. So in closing, the AHEC Scholars Program, it's not just about training, it's about creating a lasting impact. So by addressing the needs of the rural and underserved communities, we're building healthier futures for everyone. And I believe that is the end. Let's go ahead and stop sharing. I wanted to ask a quick question. How many of you, before I even started had ever heard of AHEC or the AHEC Scholars Program. Okay. It's definitely more than I thought, but not very many. Okay. See about 5 hands. I mean, that's a decent amount. So I want to say when I was approached in my last, it was in my last year of social work that I actually did at UTA. Um, I was approached to become an AHEC scholar, and I had never heard of the program. I didn't know anything about it. So it was definitely interesting to hear and then be involved in it. I would say it definitely diversified my education and my awareness of, serving these populations and the gaps that are apparent that need to be addressed. So I appreciate that. Thank you. We definitely need to get the word out. Absolutely. I can send you my slides as well. Pull up the chat. Yes. So their last 2 years, they would qualify for this program. And I can send you my slides as well as the full list of disciplines. Sulin. I think I sped through that pretty quick. Does anybody have any other questions that I could help address or maybe clarify?
And we can share these slides as well. And one additional thing that I wanted to mention is that Sharon is going to double check, but we think that this is probably going to be a half contact hour for y'all today for our attendees. So just to let you know. And then does anybody else have any other questions? Y'all can unmute. You're welcome to turn on your camera. Throw it in the chat.
Definitely. I'm here to answer any questions. I know when I first started the program myself, I was pretty confused. Like I said, I had never heard of it before. So
Looks like Jana has her hand up.
I think she had it up from the question earlier.
yeah, I think when I asked if she had ever heard of it before.
Yeah, sorry about that.
So I think out of like 14, 5 people had heard of it before. So making a little bit of progress there. But we do have nursing students that are scholars as well, mostly in the Victoria region, I think, because there is a nursing college there. You'll have to excuse me, I just got back from like a director's retreat from all last week. And so it's just kind of been thrown back into it this week.
Do you have any examples that you can share, Allison, of like a nursing student who has done this program? Like, is there any testimonials, or maybe there's a website we can go to or suggest?
I believe there's definitely testimonials on the UTMB website that was linked at the end of that PowerPoint. Nursing students, I haven't had any nursing students myself, but I know that other regions definitely have. And I can share the contact information for the directors in other regions as well as get some of those testimonials too to provide. I mean, I've been through the program myself, but that was through a social work degree. So I guess it would look a little differently, but it's mostly the same. We focus on the core. I'm losing my train of thought here, but the core disciplinaries, um, and then kind of engage and fill those gaps. So being able to, get a nursing student and then put them back in a rural community, like I said, is it's like number one. So That's our ultimate goal, is being able to equip these rural and underserved communities with healthcare professionals. So that's the entire point of the program. Chris in South Plains. Thank you. I'm not familiar with Chris. That may be a different branch of AHEC, not in AHEC East. South contacts.
Yeah, they have a South Plains. It's SP AHEC. So it's a separate area, but
I see that.
yeah, but we have worked with a couple different groups, a couple different AHEC groups. So that's why it was nice to meet you in our area AHEC.
Yeah, and I will admit I am a brand new director. I'm coming up on about a year, January 31st. So it's come full circle from scholar to director. So to be a little bit patient with me as I'm coming up to speed and definitely trying to build up the DFW region. That's awesome.
Great.
I'm definitely excited to partner with each and every one of you for getting this opportunity out to your students for sure, because it was invaluable to me as a student. So I appreciate your time.
Well, Allison, if you wouldn't mind, would you drop your information in the chat? And then if anybody wants to reach out to you directly and get more information, they can do so. And then I will also upload the PowerPoint into the chat, so you all can have that too. And if anybody has any questions for Allison, y'all will be able to reach out to her. And I hope that y'all have a great rest of your day. We're ending early today, so thank you, Allison. Perfect.
Thank you guys. I appreciate you having me. Definitely reach out if you have any questions.
Thanks, Allison. I appreciate it.